Hello, my name is Ray Camacho, and the case presentation that I'll be presenting to you is Irritable Bowel Syndrome, or as some would like to call it, IBS. A typical patient presentation could be one like this of a 32-year-old female who is a nurse that has symptoms that include nausea, epigastric pain, fullness, bloating, constipation, and left lower quadrant pain with bowel movements. These events started about 4 years ago following an episode of severe diarrhea after a family dinner. She usually has 2 to 3 small hard stools per week and generally around midday. She feels she's never completely empty. Her pain is improved when she has a bowel movement, but she often strains to have a bowel movement. She often gets abdominal pain, which is even worse when she forgets to take her fiber and drink plenty of water. Former smoker, she quit about 5 years ago. She has no family history of GI disorders, but sees a psychiatrist for depression, and she is on SSRIs. Etiology. The causes of irritable bowel syndrome remain poorly defined. A variety of physiologic factors seem to be involved in IBS symptoms. These factors include central neurohormonal mechanisms like abnormal glutamate activation of N-methyl deaspartate receptors, activation of nitric oxide synthetase, activation of neurokinin receptors, and induction of calcitonin gene-related peptides. The limbic system mediation of emotion and autonomic response enhances bowel motility and reduces gastric motility to a greater degree in patients who are affected than in patients who are in control. The hypothalamic pituitary axis may be involved in the pathogenesis of IBS as well. Motility disturbances correspond to an increase in hypothalamic corticotropin releasing factor production in response to stress. Also, intestinal permeability appears to be increased, especially in diarrhea predominant irritable bowel syndrome. Alterations in the intestinal biome show that small bowel bacteria overgrowth provides an unifying mechanism for the common symptoms of bloating and gaseous distension in patients with IBS. Dietary intolerance shows that bloating and distension may also occur from intolerance to dietary fats. Reflux-mediated small bowel gas clearance is more impaired by the ingestion of lipids in patients with irritable bowel syndrome than in patients without the disorder. Studies of elimination in challenge diets have suggested that poorly absorbed short-chain carbohydrates in the form of fructose or fructans may create symptoms among adult patients with irritable bowel syndrome. Background: Irritable bowel syndrome is a functional gastrointestinal disorder that affects 10 to 15% of people worldwide. Irritable bowel syndrome is a common disorder that affects the large intestine. Signs and symptoms include cramping, abdominal pain, bloating, gas, and diarrhea or constipation, and at times both. IBS is a chronic condition that you'll need to manage long term. Only a small number of people with IBS have severe signs and symptoms. And there's 3 types of IBS. Background continue. 3 types of IBS are based on different patterns of changes in your bowel movements or abnormal bowel movements. For example, IBS with constipation on days when you have at least one abnormal bowel movement that presents more than a quarter of your stools hard or less than a quarter of your stools loose. There is also IBS with diarrhea on days when you have at least one abnormal bowel movement where more than a quarter of your stools are loose or watery, or less than a quarter of your stools are hard or lumpy. And in some occasions, IBS can be presented with mixed bowel habits on days when you have at least one abnormal bowel movement where you can see that more than a quarter of your stools are hard or lumpy and more than a quarter of your stools are loose or watery. Risk factors. Being a woman could be a risk factor. About twice as many women as men have the condition. It is not clear why, but some researchers think that the changing hormones in the menstrual cycle may have something to do with it. Age. IBS can affect people of all ages, but it's more likely for people in their teens through their 40s. Family history. The condition seems to run in families. Some studies have shown that your genes may play a role. Emotional trouble. Some people with IBS seem to have trouble with stress, have a mental disorder, which is caused by a traumatic event in their lives, such as sexual abuse or domestic violence. But it is not clear what comes first, the stress or IBS. Food sensitivities. Some people may have digestive systems that rumble angrily when they eat dairy, wheat, a sugar in fruits called fructose, fatty foods, carbonated drinks, and alcohol can all also upset digestion. There's also no proof that any of these foods cause IBS, but there is proof that they may trigger symptoms. Another risk factor might be medications as well, and other digestive problems like stomach flu, traveler's diarrhea, or food poisoning. Some scientists think that these illnesses may trigger a person's first IBS symptoms. Post-infections IBS occurs in up to 32% of people who've had about an acute stomach flu. Symptoms like abdominal discomfort and diarrhea can last 2 to 3 years. Pathophysiology. The causes of irritable bowel syndrome remain poorly defined, as I mentioned earlier, but there's a three-part complex that plays part into the pathophysiology of IBS. These include altered gastrointestinal motility, visceral hyperalgesia, and psychopathology. First, in the three-part complex of IBS, there is altered gastrointestinal motility, which includes distinct variations in the small and large bowel motility. The myoelectric activity of the colon is composed of background slow waves with superimposed spike potentials. Colonic dysmotility in irritable bowel syndrome manifests as variations in slow wave frequency and a blunted late peaking postprandial response to spike potentials. Patients who are prone to diarrhea demonstrate these alterations to a greater degree than patients who are prone to constipation. Small bowel dysmotility manifests in delayed meal transit in patients prone to constipation and in accelerated meal transit in patients prone to diarrhea. In addition, patients exhibit shorter intervals between migrant motor complexes, the predominant interdigestive small bowel motor patterns. Curie theories integrate these widespread motility variations and hypothesize a generalized smooth muscle hyperresponsiveness. They describe increased urinary symptoms, include frequency, urgency, nocturia, and hyperresponsiveness to methacholine challenge. Visceral hyperalgesia is the second part of the traditional three-part complex that characterizes irritable bowel syndrome. Enhanced perception of normal motility and visceral pain defines IBS syndrome. Rectosomoid and small bowel balloon inflation produces pain at lower volumes in patients than in controls. Notably, hypersensitivity appears with rapid but not with gradual distension. Patients who are affected describe widened dermatomal distributions of referred pain. Sensitization of the intestinal afferent nociceptive pathways, the synapse in the dorsal horn of the spinal cord, provides a unifying mechanism. Psychopathology is the third aspect of the IBS complex. Associations between psychiatric disturbances and irritable bowel syndrome pathogenesis are not clearly defined. Patients with psychological disturbances relate more frequently to IBS and debilitating illness than control populations. Patients who seek medical care have a higher incidence of panic disorder, major depression, anxiety disorder, and hypochondriasis, a condition in which a person is excessively and unduly worried about having a serious illness. An axis 1 disorder coincides with the onset of GI symptoms in as many as 77% of patients. Axis 1 disorders tend to be the most commonly found in the public. They include anxiety disorders such as panic, social anxiety, and post-traumatic stress disorder. A higher prevalence of physical and sexual abuse has been demonstrated in patients with irritable bowel syndrome as well. The most common symptoms of irritable bowel syndrome are pain in your abdomen, often related to bowel movements and changes in your bowel movements. These changes may be diarrhea, constipation, or both, depending on what type of IBS you might have. Other symptoms of IBS may include bloating, the feeling that you haven't finished a bowel movement, or whitish mucus in your stool. Also, women with IBS often have more symptoms during their menses. IBS can be painful, but it doesn't lead to other health problems or damages to your digestive tract. To diagnose IBS, doctors will review symptoms and medical family history and perform a physical exam. A doctor will ask you about your symptoms and look for a certain pattern in your symptoms following the Rome 3 criteria. This criteria follows IBS and requires that a person can be experiencing chronic abdominal pain or discomfort at least 3 days over the course of the last 3 months, with an onset of symptoms at least 6 months prior. These symptoms must also show pain symptoms that are lessened with the bowel movement. Symptoms onset is related to a change in the frequency of stool. Symptoms onset is related to a change in the appearance of stool. A doctor will ask for medical and family history with diseases such as celiac disease, colon cancer, or inflammatory bowel disease. Doctors will also ask about medicines you take, recent infections, stressful events related to the start of your symptoms, what you eat, your history of other health problems that are more common in people who have IBS. During a physical exam, a doctor will probably check for abdominal pain or bloating, listen to sounds within your abdomen using a stethoscope, taps on your abdomen checking for tenderness or pain. Doctors may perform other tests to rule out health problems that cause symptoms similar to IBS. These tests may include blood tests to check for conditions other than IBS, including anemia, infection, and digestive diseases. A stools test, which requires for blood in your stool or other signs of infectious or disease. And there's other types of tests that include hydrogen breath tests to check for small intestinal bacterial overgrowth or problems digesting certain carbohydrates such as lactose intolerance, or a colonoscopy to check for conditions such as a colon cancer or inflammatory bowel disease. Doctors may treat irritable bowel syndrome by recommending changes in what you eat and other lifestyle changes, medicines, probiotics, and mental health therapies. Changes to what you eat include eating more fiber and avoiding gluten. Also, research suggests that other lifestyle changes may help IBS symptoms. These include increasing your physical activity, reducing stressful life situations as much as possible, and getting enough sleep. Medicines that will be recommended by doctors for IBS with diarrhea will be loperamide or rifaximin. To treat IBS with constipation, a doctor may recommend fiber supplements or laxatives. Probiotics might also be recommended. Probiotics are live microorganisms, most often bacteria, that are similar to microorganisms you normally have in your digestive tract. And mental health therapies may be recommended by a doctor as well to improve your IBS symptoms. These therapies include cognitive behavioral therapy, which focuses on helping you change thought and behavior patterns to improve IBS symptoms. God-directed hypnotherapy, in which a therapist uses hypnosis, a trance-like state in which you are relaxed or focused. Or relaxation training, which can help you relax your muscles or reduce stress. Thank you for listening to this presentation. I hope I was able to help you understand a bit more of IBS. Thank you.